I'm Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. We've talked a lot about heart disease and different aspects of cardiovascular illness in this series of videos because cardiovascular disease is still the #1 killer in the US. Strokes and heart disease are killers, and not just the United States, but most of the Western world. And so it's something that we really need to pay attention to, and more aspects about the cardiovascular issue that we understand, the more that we could tackle it, and we can really start to decrease some of these really horrible statistics of cardiovascular disease. So today I'm bringing you another study that looks into the issue. One of the independent predictors of cardiovascular disease is arterial stiffness. So there's different blood vessels in the body. There's arteries and veins, and then lots of other kind of subcategories. And aortic stiffness is an independent predictor of cardiovascular disease. And the way that this is evaluated at the research level is they look at pulse wave velocity. And if we can get pulse wave velocity to go down, that means that we've improved the flexibility of the blood vessels. And we want arteries and the aorta to be flexible. The more flexible it is, the lower the chance that heart disease in plaquing and hardening of the arteries is going to develop. So we want flexible blood vessels. And so they did an interesting study where they used a low-carbohydrate diet in a group of men and women, and then they evaluated the pulse wave velocity. And then they also evaluated their body weight, because in this group of subjects, they looked at men and women who had insulin resistance and metabolic syndrome. Remember, these conditions, metabolic syndrome, insulin resistance, are pre-diabetic situations. And so the patients were, for the most part, obese, and they had metabolic syndrome, which means they had like high triglycerides, their glucose metabolism was off, their HDL was low, their waist circumference was above 40 in men, above 35 in women. So these are the criteria that we use to diagnose somebody with metabolic syndrome, and it puts them at a really significant risk for developing diabetes, but also cardiovascular disease. And so what they found in just 4 weeks on a low carbohydrate diet, that there was a significant improvement in this pulse wave velocity. In other words, their aorta, their arteries, got more flexible. But the big but is that this only happened in women. So women really enjoyed the benefits of this short-term 4-week low carbohydrate diet. In men, the pulse wave velocity did not actually improve. However, weight improved significantly more in men than it did women. So on the low carb diet, men lost more weight than women. So this is only a 4-week study, and I think that's an important point. 2 important points to make about that is that, first of all, in a very short period of time, just 4 weeks, I mean, you can do pretty much anything for a month. And in just this very short period of time of a low carbohydrate diet, there's like significant independent risk factors for cardiovascular disease really changed in different ways. In men, weight went down more. We know weight, obesity, being overweight is an independent risk factor also for diabetes and heart disease. So it's a little bit different from men to women. And then women had the improvement in the pulse wave velocity, which indicated improvement in the flexibility of their blood vessels. Both men and women lost weight. On average, I think as a group is about 5 pounds, but men as an average lost more like 7 pounds in the month. But so there's still weight loss in both groups, but really the significant change to the flexibility of the blood vessels was just in women. So imagine if this is 2 months or 3 months or 6 months or a whole year. It'd really be interesting to follow this group, or have another set of researchers reproduce these same results, but have them check it month after month for a period of time, and I think the results would be even more profound. But again, just in a very short period of time, 2 significant risk factors for cardiovascular disease and diabetes improved. Weight loss in 4 weeks, and improvement in blood vessel flexibility, 2 major and independent predictors of cardiovascular disease and diabetes and other conditions, frankly. So that was interesting. That was published just a couple months ago in a journal called Metabolic Physiology and Nutrition, Applied Physiology, Nutrition and Metabolism. And it was a sophisticated, interesting study in a interesting medical journal. So hopefully that was helpful. You learned something. Don't be shy about following a low carbohydrate diet. Even for a short period of time, you'll achieve some significant benefits. They can really decrease the chance of this #1 killer in the United States. So I hope that helps. I'll keep reading these studies and bring you the information. Until then, keep it real.